American benefits to pensioners in the United States encompass a broad array of federal and state programs designed to provide income support. Healthcare coverage, supplemental assistance, and other forms of social and financial protection to older adults aged 65 and over. Younger individuals with qualifying disabilities, survivors of deceased workers, and other eligible groups, forming one of the most comprehensive social safety nets in the world. With Social Security and Medicare serving as the foundation of retirement benefits for millions of Americans. Social Security retirement benefits are the core income support mechanism for pensioners and their families. Administered by the Social Security Administration, and funded through payroll taxes under the Federal Insurance Contributions Act (FICA), with eligibility generally requiring that individuals have worked and earned at least 40 credits equivalent to about 10 years of work in jobs where Social Security taxes were withheld. Once eligible, American workers can begin claiming retirement benefits as early as age 62, although claiming before full retirement age results in permanently reduced monthly payments, while delaying benefits until age 70 can increase the monthly benefit amount due to delayed retirement credits. And spouses and survivors may also be entitled to benefits based on a worker's earnings record, with a spouse potentially receiving up to 50% of the worker's benefit, and survivors receiving dependent or widower benefits. These monthly payments provide replacement income that helps pensioners cover living costs, and in recent years, the average monthly benefit for retired workers has exceeded $2,000. Demonstrating the scale of support these payments can provide to ensure that benefits remain meaningful in the face of rising living costs. Social Security includes an annual cost of living adjustment COLA that increases benefit payments based on inflation, helping pensioners maintain purchasing power over time. For example, a COLA of around 2.8% is expected to increase monthly payments for nearly 71 million recipients in 2026. Translating to over $56 extra per month on average, though many seniors feel that such adjustments do not fully match their actual expenses, especially healthcare and housing costs. In addition to retirement benefits, the Social Security system also provides survivor benefits to widows, widowers, and dependent children of eligible workers, as well as disability insurance for those who become disabled before reaching retirement age, all of which contribute to financial stability for pensioners and their families. Complementing income support, Medicare is the federal health insurance program primarily for Americans aged 65 and older. Established by the Social Security Amendments of 1965, which also created Medicaid. Medicare provides a broad range of healthcare benefits, including hospital insurance Part A, medical insurance Part B, optional prescription drug coverage Part D, and private plan alternatives under Medicare Advantage Part C. Covering essential services such as hospital stays, skilled nursing facility care, doctor visits, preventive services, and prescription drugs. And while it does not cover all medical costs such as long-term custodial care, It dramatically reduces out-of-pocket expenses for pensioners, and many beneficiaries qualify for premium-free Part A if they or their spouse paid Medicare taxes while working for at least 10 years. With Part B and Part D providing additional coverage options that can be further supplemented by Medicare savings programs or extra help, based on income and resources. For many pensioners with limited income and assets, Supplemental Security Income (SSI) offers additional monthly payments designed to support basic needs for food, clothing, and shelter. And unlike Social Security retirement benefits, SSI eligibility is based strictly on financial need rather than work history. Individuals aged 65 or older who meet the income and resource requirements can receive SSI benefits, which can be combined with Social Security payments if the total income is below a certain threshold, potentially increasing financial security for the most vulnerable pensioners. States often supplement federal SSI through state supplementation programs, which provide additional monthly cash benefits or services to elderly or disabled residents who qualify for SSI, though the amount and eligibility criteria vary by state, reflecting the decentralized nature of some supplemental support. Beyond federal SSI, many low-income seniors can access other targeted support programs, such as the Supplemental Nutrition Assistance Program (SNAP), formerly known as food stamps, which helps eligible older adults with limited income purchase nutritious food. Eligibility criteria for seniors may be more flexible in some respects, allowing those over 60 with limited income and resources to qualify, and SNAP benefits can significantly reduce food insecurity among pensioners. Other types of means-tested assistance include housing support programs, such as Section 8 rental vouchers, which subsidize rental costs for low-income seniors, and the Home Energy Assistance Program (HEAP), which provides cash grants to help with heating and cooling costs. Together, these programs lighten the burden of essential living expenses for older Americans on fixed incomes. In the realm of healthcare support beyond Medicare, many pensioners take advantage of Medicaid, the joint federal-state health insurance program for low-income individuals, which can cover services not fully covered by Medicare, such as long-term care, personal care services, and certain prescription drug costs. Pensioners who are duly eligible, qualified for both Medicare and Medicaid, often receive integrated care through coordinated programs like the Program of All-Inclusive Care for the Elderly PACE, which provides comprehensive medical and social services with little to no premiums or deductibles for those who qualify, enabling many older adults to remain in their communities rather than entering institutional care. Healthcare cost sharing can be further reduced through Medigap Medicare supplement policies sold by private insurers to cover gaps in original Medicare, such as deductibles, co-payments, and coinsurance. While these policies require separate premiums, they can significantly lower unexpected medical expenditures for pensioners. And when combined with Medicare Advantage or Part D prescription drug plans, they offer flexible coverage options tailored to individual needs. Many pensioners also benefit from tax provisions that lessen financial burdens, including higher standard deduction amounts for taxpayers aged 65 and older. Potential exclusions of Social Security benefits from taxable income depending on total income levels, and other tax credits that reduce federal income tax liability, providing additional disposable income for retirees. For example, seniors may retain more of their income tax-free due to increased exemption amounts for older taxpayers, reducing the impact of taxes on fixed retirement incomes. Pensioners who have served in the U.S. military may also receive additional benefits through the Department of Veterans Affairs (VA), including disability compensation, healthcare services, pensions, and burial benefits tailored to veterans and their families. While these veteran-specific benefits are separate from Social Security and Medicare, they represent an important source of support for many retired military personnel. Another supplemental support for pensioners comes from special programs like the Retiree Drug Subsidy (RDS), which assists employers and plan sponsors in maintaining prescription drug benefits for retirees by reimbursing part of the cost, thereby helping reduce premiums or out-of-pocket expenses for prescription drugs for eligible retirees, especially those covered under group retiree health plans. In addition to these structured federal and state programs, non-governmental and community-based resources also play a role in supporting pensioners' well-being, including non-profit organizations that provide meal delivery, transportation services, legal assistance, and social engagement opportunities, all aimed at improving older adults' quality of life and reducing social isolation. Although the benefit system in the U.S. is robust, pensioners often face challenges including rising healthcare costs, inflation, and the need for long-term care that may not be fully covered by Social Security or Medicare alone. For this reason, financial advisors frequently recommend that individuals supplement public benefits with private retirement savings, such as 401k plans, IRAs, and annuities, to help ensure financial stability throughout retirement. In summary, American pensioners can access a comprehensive network of benefits, including Social Security, retirement, and survivor payments with regular cost of living adjustments, Medicare health insurance with optional drug and supplemental coverage, SSI and state supplements for low-income elders, SNAP and housing assistance to lessen living costs, Medicaid and PACE for integrated health services, tax advantages to reduce financial burdens, VA benefits for veterans, and additional programs that together form a multifaceted support system aimed at promoting financial security, health, and dignity in old age for millions of retirees across the United States.